Welcome to Iswam Virtual 2021.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera bagi kita semua. Om Swastiastu, Namo Buddhaya, salam kebajikan. Good morning everybody. I hope you all in good health and ready for the 13th session of Virtual Iswam 2021. The honorable all speakers, I'm Kisanti from Bogor, Indonesia. As a chairman today, I'm so grateful being well and happy to be able to meet you at this event virtually. And for my dear colleagues everywhere you are, thank you for being here with us today. It's my pleasure to welcome you all in this session. And together we will explore an update and knowledge related to anti-aging medicine as the topic of this session. And as usual, the session will be divided in two topics. The first topic will cover some important points of integrative anti-aging approach to resolve cellulite by Dr. Maya Surjadjaja, MGZ, Spesialis Gizi Klinik, IAAF from Jakarta, Indonesia. And the second topic is beauty in the concept of anti-aging medicine by Professor Dr. Wimpi Pangkaila, Spesialis Andrologi, KSAAN from Bali, Indonesia. And for all participants, please don't be hesitant to ask anything through live chat box during the session. And speaker will answer your question at the end of their each presentation. Now we will start the first topic. Let we greet our speaker today. With warm welcome, here with us, beautiful lady, Dr. Maya Surjadjaja, Master Gizi, Spesialis Gizi Klinik IAAF. Are you here, Dr. Maya?
Yes, thank you. Wonderful good morning, or before it's 10 o'clock, something over 10. Wonderful good morning. And just to make everything short, thank you for the introduction. Let me start with the lecture. Is it in Bahasa Indonesia or is it in English?
I hope you can in English because it's all, any participant from overseas.
Okay, then it will be conducted in English, right?
Yes, okay.
Okay, today we are talking about integrative anti-aging approach to reverse cellulite. Okay, that's everything about cellulite. So let's see what this in anti-aging medicine has to say regarding these topics. Oops. Wait, let me try my next slide. Okay, that's a CP. I think it's not necessary anymore. Shanti already mentioned about it. And those are the outlines. So we have like three big parts. First is, of course, when we talk about cellulite, we have to know what is the grading and the scaling of cellulite is. How cellulite look like, I think most of you already familiar with it, although some of us still confusing between cellulite and striae. They still ask, oh, is it stretch mark? No, yes, even doctor sometimes, yeah, because this topic is not learned in our common medical school. And the second is regarding the pathogenesis. And that actually the take-home message of everything is that cellulite is not only a cosmetic things, but it's also a systemic problem. So it's not just the cosmetic entity. Then the last part is how we can restore the normal structure of dermis, of course, regarding all combination of internal and external. Okay, and Cellulite is as old as actually the century. Yeah, in 1920, there are two researchers, they already described what cellulite is. And actually, according to Alcuin and Pavot, they already said that cellulite is something odematous, something systemic, something not only cosmetic. And that is a kind of circulation, kind of lymphatic, sluggish, not fluently move. So they already mentioned about it back then in 1920. But then, since you know, the development bring us more to the why it looks so bad, why it is ugly, why it's dimple. I cannot use my bikini and so on in the summer or whatever, cannot show the legs. Then it has more and more the aesthetic side. Okay, and cellulite has many allies, many names, not only one. Some call it GLD, but this is the very common one, is Gynoid Lipodystrophy, Nodular Sclerosis, and blah, 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 blah. There's so many, Adiposis, edematosa, status protrosus curti. It's try to describe what cellulite actually is. And cellulite is actually the subcutaneous tissue around thigh, buttocks, and hips, yeah, where the adipose tissue is deposited in the largest amounts, yeah, in woman body, of course. Cellulite formation accelerates through hormonal changes during adolescence, pregnancy, and around menopause, after menopause. And it's not alone, you are not alone if you have some of the dimpling. Everybody more than 20 years old, almost everybody, not everybody, 80 to 90% will have some sort of cellulite. So that is a very, very big, huge topic, and that we can see everywhere. Yeah. So there are three types of cellulite. When you can see from the slides, I think it's not so clear, but it's almost clear. So we actually have the soft one, the hard one, and the watery one. Of course, this is very lay. That is in very layman description. But they will have the fatty, the lymphatic, and the LH. Means that although the woman also practicing sport, they still have the tough type of cellulite. Yeah, and then the slender form and the hydrophic form is more the women who are sedentary and who are the women around the perimenopause age, although younger women will have the combination as well. So we cannot just put it in a box like this is the tough, this is slender, and this is the hydrophic, because we have the mixture from that all as well. How about male? Do we think male have no cellulite? They are so lucky and so happy, and we are just jealous of them. No, because male do have cellulite, yeah, but not all male. Male with certain issue, we will talk about this later when we come to the hormonal section, and this located within the neck and the belly for the male, yeah, because male, you know, the subcutaneous tissue, fat tissue in the male, the spreading is different with women. Male have kind of apple type, so that is triangle shape, the reverse triangle shape, and there they have the most of the fat, and there they will have the cellulite. Then women, most of the women, not all, have the bottom up type, yeah. So the bottom is bigger, like the pear shape type of body. So those are also where the cellulite most can be found. And we have the grading. I think you're familiar with the old grading. The old grading is the non-Berg. Yeah, they have the grading from 0 to 4. Yeah, that first is no cellulite, almost ideal, smooth surface, lying down and standing. Yeah, and then the first one is you will have it when you do the Pink's test. Then you will see the dimpling and the culosis phenomenon. Yeah, and then you will the second grade, you will see a little bit of dimple surface while you're lying down. And then the last one is of course severe. Wherever you lie, you stay, you just doing everything is seeable. Yeah, it's recognizable. And then we do have the newer grading, is the Maria-Hexel, and this Maria-Hexel is more exact. They use photographic images. Yeah, when you see there here, There are 5 key aspects: number of visible thickenings, yeah, and then the depth of the thickenings, and then you will see the various morphological models of superficial of skin changes. Then you will see the loosening and relaxation of the skin, yeah, and then you will add up number 5. You will add up every point and come to certain grade, and there are only 3 grades by the Maria Hexel. You will have the mild form, the average form, and the advanced form. Okay, so they are basing on more sophisticated with tools, with devices. That's why we call it photonumeric, because this car and they have a picture photo. Yeah, thermography, micrography, TEWL, video capillaroscopy, and electric bioimpedance as well. Okay, then that was about cellulite as a whole with the grading. And now we come to the pathogenesis, because this is the most important one. Because if we try to mild the symptoms, we try to cure even a disease, we must know clearly what is behind that. So that's the pathogenesis. So, and it's clearly stated here that it's a systematic problem, not simply just a cosmetic one. Okay, this is just a scheme regarding the lipogenesis and lipolysis with the triglycerides and insulin, and with the enzyme phosphodiesterase, that it will build the fat. You will see the estrogen, prolactin, adenosine, prostaglandin, adrenaline, and noradrenaline alpha. Yeah, because the beta receptor, we will see later that it will do the opposites. Yeah, and the other things is the good guy, the adenyl cyclase with the lipolysis. We have the thyroid, methylxanthine, magnesium, mangan, fluoride, and glutathione. That's the overview. We see those are the girls there over there, right standing, but I don't see any Asian faces there. Maybe the Asian too shy on bikini and cannot get photographed. Okay, so it is true that the exact pathophysiology is not fully understood still until now. Yeah, and several factors do contribute to to cellulite development. Of course, the sex, the genetics, and the lifestyle. Yeah. And we will see what happened actually in the cell level, that you will see the subcutaneous tissue swelling, then you will see the adipocyte structure decaying or changing, then see the vascular endothelium is thickening and enlarged. And we know the reticular fiber, right? Reticular fiber is a part of the dermis, the down part. It got hyperplasia and hypertrophy, and it all causes the microangiopathy. That's only the beginning. What about the later states? The later states is, of course, everything getting more obvious. The extensive vascular disorder, the atrophic skin abnormality, and appendages disturbances. And then the border is getting blurred. Yeah, no more that clear border. It's already blurred. And we know that chronic inflammation plays a role in fibrous septal development. So that is one more time in the picture that you will see here, the fat cell. This is the capillar, and that is a formation of fibrosis, yeah, with the fibroblast proliferation around adipose cells, progressing to peripheral circulatory failure and metabolic failure in normal tissue, yeah, and then it goes and progress, and the fat gets bigger and bigger. And the fibrous tissue also getting harder and bigger. Then it comes to the advanced fibrosis in the surrounding tissue. So those are the grading. Yeah, 1, 2, and 3. And this is one more time how it described from the pathophysiology. Here is the damage, yeah, at the reticular layer. Although the papillary layer is also impacting. That's the dermis, that's the epidermis. How about genetic? Is there any genetic factor? Unfortunately, or fortunately, yes. So there are polymorphism. We know about polymorphism. Polymorphism is not a mutation. It's just a SNP, it's an altering in the base of the DNA. Sorry. We have the polymorphism, yeah. And then there are 25 polymorphism, which is not mutation, I repeat, it's just a SNP. Yeah, it's just many of us got polymorphism and very rare will have mutation. And those are two genes. First is ACE, RS1299752. Two they have numbers, and the other one is HIF1A. Yeah, those are the genes that could be identified by aesthetic cellulite. And these have also family tendencies, although we know family tendencies is not only because of the gene, but it's also because maybe the surrounding, you know, that the epigenetic, that we become what we are is a joint for genetic and the environment. So maybe the genetic and then plus the environment, like we say in most of the diseases, that the genetic of course has the portion in the pathogenesis, but the environment, actually what we do is pulling the trigger. Yeah, the gun is loaded, but the trigger is not pulled. And by having the wrong environment, the trigger is pulled. Then it happens. Okay, that is one more thing. If we can see the picture here, those are thermograph. Yeah, the green one is the cold one. The cold one is the cellulite prone one. And then by having increased calorie intake, like we all know now, staying at home, we know, and now we are staying at home, we used to have more calorie, more temptation, maybe because we are no more that active as usual. Then the tissue, adipose tissue, will be expanded and it will have a stimulus in the HIF1 gene. Okay. Then it have the fibrogenic response and local inflammation. It will stimulate those of the cascade, and it will start with the chronic inflammation. And as a response to the chronic hypoxia, there will be microcirculation disorders, local inflammation, endothelial dysfunction, and fibrosis. So when the girls are lucky enough and they have the polymorphisms of 1154, whatever HIF1A, they will have the activity of HIF1A factor reduced. And these lucky girls or lucky ladies will not develop cellulite. And even though they develop cellulite, it will come very mildly, very slightly in a very low level. Yeah. And now we know that there is a genetic correlation between GLD and HIF1A or HIF1. Okay, that is, and in between, what caused them is the hypoxia and the disturbed microcirculation. Okay, when we see the adipocyte cell, when I studied medicine many decades ago, adipocytes is just like an organ just for bumpering erect, that you have fat. Okay, so when you fall, you will be protected. It will protect your other organ. But nowadays, adipocytes is no more that. Adipocytes is a very active endocrine organ. And that is the pathogenesis of lipodystrophy. The pathogenesis is also here. Yeah, that if it is become a failure, we will see in excess adipose tissue, you will see it will come to insulin resistant, that insulin will be secreted more, come to hyperinsulinism until the body cannot conquer it, then it will come to pre-diabetes and then it will come to diabetes. Yeah. So then it will also impair secretion and production of adipocytokines. Those are adipocytokines, many molecules that impact also in the hormonal cascade. And it will affect directly with the excess body fat, the vascular dysfunction. So it will make everything, the cascade going down, and will make it worse. Yeah, reduction of microcirculation, the cells will constrict, the fibrous will get more, and we will see, maybe only as aesthetic doctor, we will see only the, oh yeah, dimpling getting worse. But actually what the mechanism behind that is important. Okay, endothelial dysfunction, endothelial damage, and it comes to insulin resistance, even the endothelial dysfunction is also an independent risk factor for CPD, cancer, and T2DM. All metabolic diseases, almost all chronic diseases is caused by silent chronic inflammation. And the damage also that cause result in ROS production and excessive protein glycosylation. We know now that protein, it can go to Maillard reaction when we take a lot of sugar. The protein will come to a binding. It's called a Maillard reaction, and it will produce the H, spelling AGE, is a glycosylation. Yeah. And another thing is through reducing the nitric oxide and increasing growth factor, and again the adipocytokine or other cytokine, the pro-inflammatory one. And these things happen and speculate in cellulite, but the speculation is very, very high. So that now when we see a patient with cellulite, we are not thinking only of aesthetic and cosmetic issue. Okay. And then this is the cascade again going down, that when obese people, they will have two sorts of macrophages. And we know that M1 macrophages with mast cell is the one that is responsible for the development of inflammation and the production of pro-inflammatory cytokines. We have the good and the bad guy, but the more product is the bad guy, the IL-6, IL-12, TNF-alpha. Yeah, and high level of IL-6 is an independent risk factor for cardiovascular diseases. So we know now that there is a correlation between obesity, IR, local inflammation, and endothelial dysfunction. And this pathology, the same occur in cellulite. Okay. This is another cytokine. This will come under light. We have here the leptin, adiponectin, angiotensinogen, resistin, PI1, IGF-1. But if we check the adiponectin by itself in plasma, it has no difference between ladies with cellulite and ladies without cellulite, because what happened is that is localized. Yeah, it's a local paracrine factor. But the expression of the RNA, mRNA of adiponectin in areas with cellulite is different compared to the areas without cellulite. Okay, then we have of course leptin, as we know, yeah, that leptin is produced and secreted from the fat cells. As I mentioned before, that the fat cell is not as pampering or as protection organ only, but it is for endocrine function, and leptin amount is correlates with the adipocyte site and the metabolic issue. And then if come to first, it come to like insulin, it come to hyperleptinemia, then it is responsible for the neoangiogenesis in T2DM and development in CVD complication. But we know also that leptin can become resistant as well as insulin. Okay, so that is the sum up, that cellulite is a predisposition for systemic illnesses. Okay, then we come how then to restore the normal structure of dermis. What can be combined, the internal and external procedures? Okay, I will not talk a lot about the external procedures because there are so many, and we will go over time. The time will not be enough. The moderator will going to stop me, and we won't have time for Q&A because there are many things. Yeah, starting from the topical agents. Yeah. And then we can use the external, yeah, we can use the energy-based devices. We know the radio frequency, we know the laser light, and then acoustic wave therapy, and then we have this and dermology, and then we have the subcision. Most of the plastic surgeon is going to do this, the subcision. And then the newer is injectable biologic medication, and then derma filler is also being used. But from this all, there will be a study, then a review of the study is acoustic wave therapy subcision, and NDIAC 1440 nanometer is the one that has the most beneficial result. Okay, So this is an article about systemic evaluation, a review, an evidence-based review that provide the first time of all the systemic evaluation of scientific evidence, 67 studies of treatment efficacy for cellulite reduction. And unfortunately, it's written here, no clear evidence of good efficacy could be identified in any of the evaluated cellulite treatments. Yeah, and the AWT and DX are the most studied, yeah, but none of these studies also from that they reviewed, the 67 studies were controlled. Yeah, they have precise techniques, but no biophysical measurement. Yeah, and they use most only surrogate markers like circumference measurement, like USG, like thermography. Yeah, although validated and widely accepted clinical rating scale is available, so the high number of studies unfortunately did not use a clinical assessor's rating. So from these 67 studies, only 19 have placebo-controlled studies with randomization. And they give their recommendation, the reviewer, should use consort, yeah, and then effective strategy to avoid potential bias like blending, randomization, comparison with the placebo. And they suggest also efficient strategy which has an intra-patient design and increasing trial quality. So need high quality trial design for testing cellulite treatments efficacy. Yeah, they have methodological flaws, do not use cellulite severity as an endpoint, and not provide sufficient statistical analysis. So cellulite treatment remains challenging. Then they need more RCTs with high quality trial design. Okay, and we know that improper lifestyle, sedentary lifestyle, lack of physical activity will cause weakening of the muscle layer and cause more secondary hypoxia and ischemia. And of course, also the chronic use of oral contraceptiva. I will come to it later, I hope, if there is time. And the diet itself, it can work, yeah, because it will reduce the hyperinsulinemia. The proposed ketogenic diet with the restricted carbohydrate will increase lipolysis and improving liquids drainage and reduce fat tissue. Those are the diets. No, not too much fat and carbs and sugar, of course. And then no alcohol consumption, because alcohol will cause body dehydration, yeah, and excessive and improper storage of fat, yeah. Then reducing or not smoking at all, because we know that nicotine causes constriction of small blood vessels, and it will make the hypoxia and the damage in macrocirculation more advanced. And it can develop GLD and result in clinical progression. As a pillar of anti-aging, we have the nutrition, we have the physical activity, but the physical activity, you see there, the squatting, the yoga, the lungs, the strength training program, especially on lower body movements, squats, steps up, lunges, those are the exercise. Then of course, the way we have our clothes and our footwear, set but true, high heel shoes, ladies, adverse impact on muscles of calves, disturb the good posture, weaken the function of the muscle pump of shins. Then it's bad for transferring the venous blood to the heart. We will see patients with varices, yeah, and they will have also hemorrhoid as well with the high heel shoes. But high heel shoes make us sexy, so it's difficult. Everything has pro and contra. Okay. And then the other pillar of anti-aging is the nutraceuticals. And these are many, many things. I cannot highlight all. What I put here is only as an example, is the specific bioactive collagen peptide. Yeah, that they make a clinical study for the first time. And after 6 months of BCP treatment, they will see the improvement in cellulite scar, decrease in waviness of the thigh skin, and dermis density is getting stronger. Those are the trials, yeah, that improvement of the skin appearance in women suffering from moderate cellulite. Dose is 2.5 gram. Yeah, based on the current data, it can be concluded that the long-term therapy with orally administered BCP leads to an improvement of cellulite and has positive impact on skin health. And then this is another study how it works. Yeah, just more the mechanism why the collagen peptides work. That come through the specific and complex multi-step of hydrolysis. It will have the dermal and subcutaneous connective tissue in their dimple appearance. That it will give the stimulatory effect on the metabolism. That is the orally ingested BCP that will enter the blood circulation system and they will be transported to the skin, and the food-derived collagen peptides are absorbed mostly as free amino acids and also as collagen-derived peptides, so that it is absorbed. This is another study using another substance, another nutraceuticals, is polyphenol-rich chokeberry juice, 90 days, 3 months. It improves cellulite and marked reduction of subcutaneous tissue thickness and edema. And then we have other stuff like carnitine. Yeah, we know that carnitine can be transported fatty acid, yeah, to the mitochondria, and it will release the fat. It will do the lipolysis, and as we know from the mesotherapy, also this is phosphatidylcholine, that it will stimulate cytolysis of triglycerides in adipocytes, and many others. And another pillar which is important in anti-aging medicine, and we have to enlighten also, is the hormonal imbalances. Because we know that cellulite actually happen when we are in the different hormonal situation. Like in the puberty, it starts to show up. The lights, the stimulant, the mildest form of cellulite start there. And then of course pregnancy. Yeah. And then premenopause, the many years of premenopause, 15 years maybe before the menopause will come. Yeah. And then in premenopause, we know that actually all the hormones are getting low. The lutein and the FSH is getting skyrocketing high, and the peripheral hormone is getting low. But in relation to the lowest of the progesterone and lowest of the estradiol, there are still a hyperestrogenism. So still the estrogen, although it is lower, it is getting a little bit more, and it will come to hyperestrogenism. So that the swelling will be more, and also the growth of fatty cellulite tissue. Okay, and this is all the hormones and neurotransmitter that will work in the lipolysis. We have the adrenaline and noradrenaline, E2, T, ACTH, growth hormone, TSH, leptin, ADH, glucagon, and many more, maybe like 15 hormones at least will work and will cause the benefits or the opposite. So, and then this is a bit from adrenaline. Adrenaline is secreted from adrenal medulla and fibers of sympathetic nervous system. And it has two receptors, like I said in the beginning, the alpha and the beta receptor. And this stimulation influences both kind of receptor. The alpha one is not the good guy in terms if we want to lose fat. But the beta receptor is a good guy. It will cause lipolysis. So, of course, via the receptors, yeah, and it depends from we eat. What we eat will suppress the others receptor. But unfortunately, again, with aging, the amount itself of beta adrenergic receptor is reduced. When the amount is reduced, the fatty tissue amount will increase. That's why it's the accumulation of fatty tissue in menopausal women. That's why when we have patient menopausal with the cellulite, and they will say, doctor, why is still there? Why the result is not so good? Why it's only minimal? Because of those hormonal changes, what happened in the menopausal woman. This is more the mechanism with the active G protein, and then the adenyl cyclase, CMP increase, activate protein kinase, yeah. Then the store up lipids will be disintegrated. Yeah, with the help, of course, of with another enzyme, there's nutrient, natural fat lipase, so triglyceride will be downgraded. This is the lipolysis. So, and we know that we have insulin, and unfortunately, again, insulin is one of the few hormones that increase when we are getting age. When we are getting older, insulin will increase, and that is a lipolysis blocker, and it stimulates the LPL and the synthesis of lipids, capture the free fatty acids, and then it will influence the SRAP-PP1 transcripting factor, and it will come to lipogenesis. So then it's not good when we are getting older, actually, yeah. So that's why we need anti-aging medicine. And that is another hormone, which growth hormone. We know that growth hormone influence also the body composition. It will increase the muscle, increase the bone, and reducing the fat. And unfortunately, again, growth hormone will be division when we are getting older. Okay, so we know that in menopause, there is an upset imbalance between noradrenaline and neurotransmitter, dopamine, serotonin, other endorphin, and then also the balance between progesterone, growth hormone, melatonin. Melatonin is an important hormone. We should highlight it one day, and DHEA, androgens, or insulin. And again, we know that in the menopause, when we see, is the time still there? The time is up, right?
Oh, no, it's continued, please.
Okay, we know when they see the pair, like the happily married couple, male and female, and then we will see why will the grandmother look like the grandfather, and the grandfather will look like more like the grandmother. When they married a long time, we said that, oh, maybe it's because they are together and they will be similar, but actually no, because of the hormone. That the grandma, the hormone of the woman hormone will get lower, right? Although it comes to relatively increasing, and in relatively estrogen will get higher, but in general it will get lower. So then the androgen hormone from the oma, from the grandma, will getting relatively higher. So that's why they will come to relative hyperandrogenism. Okay. So that even the stroke and the cardiovascular evidence in the postmenopause woman, postmenopause lady are getting higher, because in relation they will get a hyperandrogenism. So the grandmother will look like the grandfather, will be more, the grandmother will be more calm, thinking clearly, sorry grandfathers, and the grandfather will have reducing in their testosterone, and because of the aromatization, and the granddad will have more in relation to female hormone. So that is. And another bad things is still there, is in climacteric woman, they will have increased production of cortisol. See, increased production of cortisol, higher concentration of alpha adrenaline and noradrenaline, and relatively hyperestrogenism, it will all make the cellulite worse. This estrogen dominance, I think I mentioned about it before, that we will see that the estrogen itself in the adipocytes, yeah, it will cause the macronodules, the fibrosclerosis, and will make the dimpling even worse. Then another good hormone is here. We, as you know, we will have the major of the female hormone is the estrogen and the progesterone. And by the relatively higher estrogen, we will have lack of progesterone, and they'll make the matter also worse. This lack of progesterone will exacerbate the fibrosis and nodule formation in subcutaneous tissue. And we know that the smooth muscle fibers, that the muscle fiber, the smooth muscle, in the blood vessel, they will have the more relaxing effect because of progesterone. Progesterone is relaxing. So, and this fiber, if not relaxed, the fiber will cause venostasis and is called disadvantageous in morphological and functional changes. And the lack of progesterone will make the microcirculation disorder getting worse because of the fiber, the pressure is more, and the vein permeability is big, and the increase of viscosity, and creating again the increase of viscosity will start the cascade with the cytokine. Yeah, we get the lipocyte tract, and the inflammatory cascade will run. So it will make the matter worse. I think I will come to the end of this. I hope I'm not taking too many times, 50 minutes, so it's only 10 minutes for Q&A. Is it
So
there?
it's okay, Dr. Maya.
Sorry for that, because it's a lot of stuff.
No,
Thank you
it's interesting presentation. Thank you. Yes. Thank you, Dr. Maya. You need more time, and I give it you. It's an interesting presentation on how to resolve cellulite from anti-aging medicine approach. Of course, it's very nice and clear explanation, and I'm sure that colleagues still not question in the chat, live chat, I think. Dr. Maya, you mentioned it before about the nutraceutical bioactive collagen peptide. It's orally intake, right?
Yeah, it is orally.
Yeah, yeah. And about the L-carnitine and phosphatidylcholine, it's can we how can we combine it with the mesotherapy? It's more of the colleagues here, the aesthetic doctor, use this nutraceutical as the mesotherapy active ingredient.
Yeah, so actually when we talk about mesotherapy, again, we have to, I'm doing mesotherapy, so not that I'm not doing, okay, I'm doing it with my patients. But as we know that mesotherapy is not evidence level A.
Yes.
Yeah, is it not? Is it a B? In category B means that it is not enough evidence whatsoever to have it in, especially in cellulite reduction or in fat loss as a whole, because most of the ladies with cellulite, they will have also fat, unfortunately.
Yes.
Yeah, problem of us all. And so the combination, I will start with actually with detox. That is my personal view. That is not what the literature says. It is from my practical point of view. I believe that majority of the patients that come to us will have actually be starting one step back, Dr. Kishanti. I start always one step back, that they will have also digestive issue. Most of them, not all, but most of them. So we will check first the digestion, the absorption of the nutrient, and do the and whether they have the hypersensitivity of certain food, because it causes swelling. And it helps us when the swelling is gone. Patient will be happier when we do mesotherapy with or without nutraceuticals. But the swelling is gone. So that is the first thing. And then of course we will prescribe the nutraceutical to help. You see that some of those are collagen peptide that is not in the market, and we will give simple antioxidant. It will help because it's just inflammation. So actually not only carnitine and phosphatidylcholine, but whatever will help with the inflammation, it will help. So you can integrate it, you can choose it, and there will be the upper limit dose is quite high. So the principle of doing medicine is primum non nocere, means we do no harm. So you will not do any harm if you combine the supplementation in the correct amount regarding to the patient.
Oh yes, thank you for answering. Dr. Maya, considering only diet, or maybe how can we choose what kind of diet for patient? Because some of the patient not only cellulite complaining, but it's also reducing the overweight or obesity. And how can we choose it for our patient?
You mean the diet choosing?
Yes.
For
for maybe
obesity,
high protein diet combined with the
never
rich
ending
carbohydrate.
question and
Yes,
never ending trial, right?
because it's
So,
there's a lot of maybe it's a paradigm or issue that fat eat fat, so we can eat a lot of fat, so we can burn fat inside. How about that?
fat is the fuel of lipolysis. So it's like this, that we know ketogenic diet is getting boomer, getting
Yes.
hype in the last time. Ketogenic diet itself at the beginning is used for epilepsy, and it is used actually for cancer patient in almost terminal states, although we can start earlier for the cancer patient and for the epilepsy, children with epilepsy. But why now it is used for us? Because many years, you are younger than me, so maybe you don't have you don't have this era. But in my era, when we eat fat, we are doomed. We are really doomed, because fat is bad. Fat will give you heart disease. Fat will give you obesity, and all the consequences mean heart disease, stroke, and cancer, and everything. But as you see, now the trend is changing. Now is that we should not take sugar. Sugar is not fat. Sugar is carb, right?
Yes.
So that start reducing sugar and reducing refined carb, because not every fat is bad. So we must know the good fat and the bad fat. Right?
Yes.
So when we take like olive oil, maybe for cooking,
Yes.
some will say, olive oil for cooking? But yes, olive oil you can do for cooking, because it has
in high temperature.
Yes, even the deep fried, because it has a high melting point, and it has only one bond, only one double bond, MUFA, monounsaturated fatty acid, omega-9. So we can take olive oil. Of course, it's expensive, so that's why the choosing for deep fried is not olive oil, but we can drizzle it in our salads, maybe, or you just put olive oil in your meat, whatever. That is the good intake, the good fat intake, and then you can have avocado, you can have walnut, and of course, these things will help your cellulite as well, because it's a good fat. It's a non-inflammatory fat. And then we have to know about the relation of omega-3, omega-6, and omega-9. That itself will come to a good ratio. So drizzling olive oil, eating a pair of walnut, of course not a big box of walnut through Christmas and New Year's, then you will gain weight. But a certain moderate amount of walnut and taking avocado and eating fatty fish, yeah, that is all the part of ketogenic diet for sure. You can do modified keto. You don't need to do all the rigorous keto. Not everyone can take it, but I mean that more fat, less sugar, and more protein will give you stronger fascia, the fibrous septa, the collagen, and will make your dimpling better.
Yes. Yeah.
And wrinkle as well.
Oh yeah, it's a double approach for anti-aging. Dr. Maria Angelina asked Dr. Maya, and about detox. She asked what kind and how long we have to do that.
Okay, so, well, that's again, Dr. Maria. I answer from my practice, from the daily practice that I do when patient come. So I will start with the testing of the patient. Okay, first we start, of course, with like a doctor office. Of course, we do the anamnesis.
Yeah.
We will do an interview. We will have a lot of questionnaire. Yeah, to fail for the patient. Sometimes they say, doctor, many questionnaire, I don't like it. Yeah. I only come for my cellulite. Why so many questionnaire? Just fix my cellulite. That's all. Yeah. But it's not that way, because we know from today that cellulite is also a systematic disease. So it's not as simple as we see many years back. So when the patient came, they will do the questionnaire, and then I will have I order certain tests. That is a hypersensitivity test, and from the test will come out that there are certain food they cannot tolerate. It's not allergy. One more time, it's not allergy. It's food intolerance is different, and based on the intolerance, I will do the detox. So that the patient cannot take it like for weeks. And then we will rotate the diet and do the elimination diet first. And then we will rotate and we will reintroduce the diet. All will take like 8 weeks till 12 weeks. And that is the first thing. And amazingly, when you practice that, you will see that a lot of maybe unsolved small problems, like they are a bit forgetful, like they have pain, a little bit pain somewhere, unclear pain, or they have migraine, or they cannot sleep. It will resolve with the time. So the patient will be very thankful. They will be happy. So when the dimpling is not gone completely, they still gain the other positive things in life. So they will be happier.
Oh yeah.
Instead of only concentrating on the dimpling and the cellulite. Yeah, the cellulite will be improved, sure. But you know, the improvement cannot be 100%. As long as we are not addressing the root cause of the disease. We have to address the root cause of the disease, then everything will go in a better way.
Yes. Thank you. Dr. Maria also asked previously about in food intolerance. How do we know the food makes the patient bloat? It's maybe correlated to the specific laboratory, maybe. Dr. Maya, are you there? Dr. Maya? Maybe it's connection, maybe it's, we still have time. Maybe it's the successful treatment remains the distant. Unfortunately, the cellulite continues to bother women, I think, including me. Dr. Maya, you there? Oh, maybe it's, time is up. Okay, let me conclude this session. The cellulite is the most or more many women hostage of costly treatment proposal, most of which without a solid scientific basis and good approach and anti-aging approach. I think it's the best solution for the cellulite for patient to treatment. Okay, after this commercial big break, we come back to the next session for Professor Dr. Wimpy Pangkaila. Thank you. Hi everybody, welcome again. Still in anti-aging medicine session in Iswam, virtual Iswam 2021. Another interesting topics is beauty in the concept of anti-aging medicine, and it will be delivered by one and only Professor Dr. Wimpy Pangkaila, Specialist Andrologi, KAASM. Here with us, Professor Wimpy. Are you there, Prof?
Yes.
How are you?
I'm fine, always fine. You too, right?
Yes, thank you. Good afternoon. I hope you're in good health. I think you getting younger and younger every time we've met. It's proof that beauty radiated from within, right? I'm still far behind you, sir. Thank you for being with us today. It's my honor. We can't wait to hear your share, your expertise. First, I want to read Professor Wimpy curriculum vitae. Professor Wimpy graduated from Faculty of Medicine, Udayana University, Indonesia, get the postdoctoral program specialist at University of Washington, USA, and Airlangga University, doctor from Airlangga University, Indonesia, and as professor of the Faculty Medicine, Udayana University, Indonesia, now as chief of the anti-aging medicine concentration for master's and doctoral program at Faculty of Medicine, Udayana University, as chairman of Center for Anti-Aging Medicine Studies, Faculty of Medicine, Udayana University, as chief of Andrology and Sexology Department, Faculty of Medicine, Udayana University. Prof. Wimpy have a lot of award in his career. It's so proudly to present Prof. Wimpy Muri World Record Museum of Indonesia, World Record as the initiator of the establishment of the world's first anti-aging medicine postgraduate program. Get Leadership Award from American Academy of Anti-Aging Medicine as founder that world's first postgraduate anti-aging medicine, and Satya Lencana Karya Satya, charter from President of Republic Indonesia. Now, let's hear an hour lecture about beauty in the concept of anti-aging medicine by Professor Dr. Wimpy Pangkaila, Specialist Andrology, KASM. The time is yours, sir. Thank you.
Thank you, Dr. Krisanti. Good evening or good afternoon now. Good afternoon, everybody. Yeah. So my topic is the beauty and the concept of anti-aging medicine. I believe all of us, all of you already understand what is the concept of anti-aging medicine. At least there are three, not at least, there are three paradigms, new paradigms brought by the concept of anti-aging medicine. First is aging process can be prevented, treated, and reversed to the functional younger state. Second is human is not the prisoner of the genetic destiny. And the third is the important, very important one is the aging process caused by the decrease or imbalance of hormone level in the body. So the third one become the very important paradigm in anti-aging medicine. About beauty, what is beauty actually? Every woman wants to be beautiful, right? And also men also, but the meaning is different between women and men. So what is beauty? Beauty is the condition of a person that gives pleasure to the senses or to the mind. So when we meet somebody, in our mind, in our sense, we can say this woman is beautiful. This man is good looking, right? We can say like that when we meet somebody. The next is, in general, women have special attention to the beauty, not only to their own beauty, but also to others' beauty. So that's why when we, I believe when women talk to the others, yeah, they will look at how the friend talking and express their face, their movement, right? But now, men also have attention to their appearance, not only women. So how the men want to be looking attractive? So that's very important in our daily life. Sorry. So what is actually the role of beauty? We can see like this. beauty is important and have an important role in the couple relationship. I have many patients how the couple relationship is disturbed or get problem because of the partner's beauty loss or decrease. The second is in social position, and the third, the role of beauty in social interaction. So these three kind of role of beauty in our life, in our daily life. What is actually the component of human beauty? First is face shape. Why a face? Because everybody, when meet the others, they must see the face first. And then the second is skin, and then body composition. And of course, this is the important is organ function. So these four components, yeah, and then completed by the attitude and behavior. So it's the five components closely related to the health condition, especially hormone function. Many people, including doctors, sometimes or many times forget that beautiful is, or beauty is not only about the appearance, but there is a very important, something important behind the face expression. So there's many people, including doctors, do not realize that beauty is closely related to the health condition. So not only the appearance, but behind the beauty, there are many factors that influence the beauty. We can see like this: face and body movement and expression. How we score people's movement and expression is expressive or poor expression. How the movement, fast, slow, or no reaction, or no reaction. Are there some signs, symptoms, complaints? Many people, when they move or talking, yeah, many of them or some of them is, problem because of the signs, symptoms, and complaint. So the result is the expression, face expression, the movement is not attractive. So beauty is not only about physical appearance. So again, that beauty is not only about physical appearance, but there is hidden factors that affect beauty. So as a doctor, for us, this is very important, to find or to evaluate what kind of factors behind the beauty. So we know the factors is we can divide into two groups. Yeah? The health condition, that's physical health physical condition, and psychological condition. And remember, this condition is very closely related to the hormone function. So what's the problem, or what's the cause of loss of beauty? Unhealthy condition, what is that? Wrinkle, other skin problems. It's very closely related to unhealthy condition. And obesity, of course. Sexual problems, poor expression of our face, of our body, and disease, disorders, and complaints. So at least there are 5 problems related to unhealthy condition that cause loss of beauty. So as a doctor, when we have a patient or face a problem with loss of beauty, don't forget to evaluate this unhealthy condition, the 5 unhealthy condition like this. So wrinkle or other skin problems, obesity, sexual problems, poor expression. So behind is diseases, disorders, and complaints. So I believe all of you have many patients complaining of wrinkle. But again, wrinkle is not only physical appearance, but there are some problems cause wrinkle. Also obesity. Many cases of obesity in our daily practice. And many of us, many doctors forget that obesity is not only about too much eating or too much sugar, but there are some hidden factors behind obesity that we have to evaluate and treat also. So in general, people consider obesity as not beauty. Yeah. So we know that even in medical societies also say like that obesity is not beauty. So like I told you before, that most people, including doctors, always identify obesity with too much eat. Is it right? Of course, it is not right. Not always right. Because there are many etiologies of the obesity that we, as a doctor, we have to evaluate and treat the etiology. So again, I remind you that there's a hormonal problem cause obesity and physical appearance. So for the example, this lady with facial obesity, in my experience, it's difficult, to take picture of a woman compared to men, Even though I always said that I cut your face, or I don't take a picture of your face, but still it's difficult. But okay, some of them ready to get picture of the abdomen. So there is another, in our daily life, we very often to find people or women like this with this condition of the obesity, especially obesity. Of course, compared to the slim one, of course, we will say that this is not beautiful. So obesity related to hormone problem is underdiagnosed in general population. Usually, like I told you, people or even doctor consider obesity as too much eat. Maybe in this session, I remind you all of us that obesity is not only about too much eat. And again, hormone function have a role in pathophysiology of obesity. That's why when we evaluate or treat a patient with obesity, don't forget to evaluate their hormone problem. So cases of obesity can be found in all ages. Baby, I think we can find many babies, just delivered, and then with the problem of obesity. Childhood, many children with obesity, youngster also, adult age and older age. So in all of 8 phases, we can find the cases of obesity now. So the question is, why? What's the problem? So remember for us that active in anti-aging medicine, remember that increased body weight and obesity is one of signs of aging process. So when we find the patient with aging process, don't forget to tell them that obesity is one of or sign of aging process that we have to evaluate and treat if we don't want to get older soon. So there are some unhealthy condition that causes aging process, and constantly aging process also result in unhealthy condition. Again, hormones have dominant role in many aspects of human life. So remember that there's no life, there's no normal life without hormone function, or if our hormone is not normal. So if hormone decrease or imbalance, yeah, we will experience many signs, symptoms, complaints, yeah, including that those related to beauty. So remember that. Don't forget to evaluate, yeah, to pay attention to the hormone problems in our daily life. So like this, melasma, I believe you who active in aesthetic medicine, especially, you will find cases of melasma. And many doctors, when get a patient with melasma, the first thing in their mind is how to treat or to clean this face. Yeah? We never think about what is the cause of melasma. In this occasion, I think I will remind of all of us that like this, melasma is closely related to hormone beside the other problems, the other causes. So that's why we have to find again the causes or the etiologies of melasma and other problems that disturb beauty. So when we talking about melasma, I believe you have many cases with melasma. Genetic factors, and don't forget female sex steroid hormones, exposure to UVB, photosensitizing medication, certain cosmetics as side effects, mild ovarian or thyroid dysfunction, and oxidative stress, of course, SOD, yeah. Yes, it's and then protein carbonyl, yeah. So look at this, there are many factors cause melasma. So that's why when we face or when you facing the patient with melasma, don't forget to find these factors, these causes, especially included related to hormone like this, female sex steroid hormone, and this ovarian or thyroid dysfunction. Of course, beside the other causes that result in melasma. So it will be better and for us as a doctor to find the etiology first and then treat the etiology, and then finally result in better skin without melasma again. So I have a patient as a side effect of laser. Yeah. So look at this. Yeah. So what is next? What is the consequences of loss of beauty? First, not attractive in social relationship, of course. Poor self-esteem. So many people, when they realize that their beauty is decreased or lost, their self-esteem decrease or poor self-esteem. And then the important thing also is sexual dysfunction of the partner. How it happened? Of course, it happened because one of the factors that excite the sexual function is the beauty of the partner. So there are many patients with the sexual dysfunction because of the loss of beauty of their partner. Poor quality of life, and then disorders caused by hidden threat. Yeah, so there are again 5 results as a consequences of the loss of beauty. Again, not attractive in social relationship, poor self-esteem, sexual dysfunction of the partner, poor quality of life, and disorders caused by hidden threats. So this is just a humor. Yeah. Even the statue of David, created by Michelangelo, become like this, loss of beauty if the hormone decline or not balanced. So what is now the effect of decreased estrogen? Decrease or deficient of estrogen. First, dyslipidemia, hair loss. Hair loss means also loss of beauty. Decreased genital sensation. Vagina is sensitive to infection. Increased total and abdominal fat. Reduced bone and muscle mass with many complaints like pain in the bone and also hot flashes. So you can remember this, yeah, that there are some effect of decreased estrogen or imbalanced hormone that result in loss of beauty. Again, in this figure, hair loss, increased total and abdominal fat, and of course the other hot flashes, and this is related to sexual dysfunction. Okay, so it means if people have decreased estrogen, yeah, so the drug of choice is how to increase or to make the hormone balance again. Every woman will find the pre-menopause and menopause time in their life. So actually, pre-menopause or menopause is unhealthy condition because the hormone is declined or even deficient. So that's why there are some symptoms as a result of pre-menopause or menopause as an unhealthy condition. So we can find as physical general symptoms, psychological symptoms, and the important thing is also sexual dysfunction because it will disturb their harmonious life with the partner. So that's why in our society, in daily life, you will find many women with perimenopause and menopause. So they need our help as a doctor to make their life normal again. So the final result is loss of beauty in women with menopause, premenopause, or menopause. So all some symptoms, complaints in menopause, actually those are manifestation of decreased hormone level. The important thing is the main hormone is estrogen, progesterone, And don't forget testosterone also. There are some physical general symptoms: hot flash, like I told you before, night sweats, sleep disorder, fatigues, itchy bone pain due to osteoporosis, headaches, tachycardia, incontinence, visceral obesity, hair loss, wrinkle, melasma. So this is closely related to beauty. And then finally, these signs, symptoms, and complaint will decrease health condition and beauty of the woman. And also the psychological complaint: anxiety, mood swing, irritability, decreased concentration, decreased memory. It's finally result in decreased health condition and beauty too. And don't forget the sexual dysfunction, including sexual desire disorder, dyspareunia, pain during sex, and orgasmic disorder. And finally, this decrease the health condition and beauty also. And of course, it will disturb the harmonious life with the partner. So, decrease or imbalanced hormone result in unhealthy condition, especially obesity and also loss of beauty. Yeah. Finally, it decrease or loss of beauty, sexual dysfunction, and finally decrease quality of life. So another hormone is that we can find in the daily practice is signs, symptoms, complaint of growth hormone deficiency in adult. So we're talking in adult. So what's the result? Increased total and visceral fat, decreased lean body mass, decreased muscle strength, decreased exercise capacity, lack of energy level, fatigue, decreased bone mineral density. Look at this: thin, dry skin, and cool extremities, social isolation, decrease and mood and depressed mood and anxiety, lack of positive well-being, dyslipidemia, impaired cardiac function, accelerated atherogenesis, sexual dysfunction, and impaired glucose tolerance. So there are so many results caused by growth hormone deficiency in adult, and it happened in many people, including women. So finally, this symptoms or this complaint will means loss of beauty. So this is a dialogue between a lady patient with me. I really don't understand, doctor, why my husband is not excited to me. As a man, do you think I am not attractive? Look at my nose, lips, breast. Now I am totally different after treatment. So what is my answer? Do you think your husband totally forget your original face? And how about his complaint that you often complain of pain during sexual intercourse? In my daily practice, there are many couples that the husband complain because of the wife always complaining of the pain during sexual intercourse. Yeah. So the husband complained, and because of the wife's complaint. So the final treatment is hormonal treatment, of course. Yeah. So this is the treatment. So based on the concept of anti-aging medicine, healthy lifestyle, there are 10 points of healthy lifestyle. Yeah, diet control, exercise, and others. Yeah, we can see later. And then as a doctor, we have to find what is the cause of loss of beauty. If we find already the causes or the cause or the causes, so we do the treatment. The important thing is the treatment should be comprehensive. So not only the symptoms, treatment of the symptoms, yeah, but comprehensive treatment, including the causes or the etiologies. And finally, on the peak is total beauty is back. So I nearly come to the end of my presentation. How to prevent the aging process, prevention of aging process. First, as the basis is practice healthy lifestyle. What is that? Regular exercise, minimum 30 minutes, 3 times a week, or almost daily, but not important to do daily exercise. Healthy and enough food, low calories and fat, enough protein, fruit and vegetables. Avoid and manage stress. Avoid all toxic substances like smoking and too much alcohol, pesticide, unhealthy preservative substance. Enough sleep, 6 to 7 hours. Balancing between work and relaxation. And then number second, happy family life, including sexual life. Avoid unhealthy sexual life. Do job as a pleasure, not a burden. Live in social environment according to your conscience. Always think positively and optimistic, not only negative, not always negative. Do not consider you are healthy and normal just because you do not feel a serious complaint. So in another word, don't wait until serious complaint appear. Okay, this is very important because many people think that they are healthy, but when they get checked, too many problems in their body. So again, do not consider you are healthy and normal just because you don't feel a serious complaint. 7, do not consider you are already old and helpless, because if you feel you are already old and helpless, yeah, it will give negative effect to the hormone. Okay. 8, do not consume medicine or mixture without scientific base and recommendation of expert. So there are many mixture we can find in the market, including many herbal, yeah, but there's no scientific base. Yeah. 9, perform periodic medical checkup according to respective condition. And the 10, take medicine or supplement based on scientific data to reverse or decrease function of organs due to aging process. Yeah, this is very important because many times in our life we don't have enough vitamins in our food. That's why many times we need to take a supplement as long as they have a scientific data that it is very useful to our body. So what kind of exercise we can do? First, jogging, of course. Stretching, squat, twist, push up, and barbell. You can do use barbell, but not too heavy. So based on your capacity, of course. I think this is 1, 2, 3, 6. Yeah, 6 kind of exercise that we need to do to prevent or to maintain to prevent aging process. Okay, I think, and then finally, what's the goal of regular medical checkup? Early detection of biomarkers of aging. Early detection of age-related dysfunction or diseases, and early intervention or treatment if needed. So by this slide, yeah, I just want to stress that goal, what is the goal of regular medical check? This 3 point of the goal is very important for us as a doctor to mention this to the patient. So without early detection, we many times we cannot know that this patient have already aging process. Okay, and last one is early intervention or treatment if needed. So we can give treatment. Don't wait until the complaints appear. Okay. This is the hidden beauty. What's the hidden beauty? Okay. I think this is the last slide. Thank you very much for your attention.
Thank you, Professor Wimpi Pangkaila. It's an interesting presentation and well insight for us to know more about the anti-aging medicine in aesthetic practice. I think we should pick more to patient to find what kind of the related disease of they're complaining in aesthetic treatment. I have no question in the live chat. Maybe I can ask privately. It's maybe like a face-to-face consultation, like. Prof. Wimpi, can you give us tips or what kind of supplement according to the COVID-19 pandemic? It's maybe we can take some supplements. According to anti-aging prevention.
Yeah, there are a lot of already many publication regarding to supplementation related to immunity, to maintain our immunity. Some of them are vitamin C, and then zinc, and then vitamin D also, D3. Yeah, this is the main micronutrient I think we need to increase our immunity. Why vitamin D3? Yeah, because many of people don't have enough sunlight, or lazy to do exercise outside of the outdoor maybe. Yeah, so that's why we need like vitamin D3 and then vitamin C and then zinc. Yeah. Another is, of course, yeah, if we have problem in our hormone level, yeah, of course it will result in a decrease of our immunity too. That's why we have to maintain our level of hormone in the normal level. I think that's the answer.
Okay, thank you, Prof. It's about the anti-aging paradigm. In our culture, Indonesia, of course, it's greater aging anxiety. It's higher importance of appearance were related to greater purchasing anti-aging products. Paradox whereby they report using this product while remaining critical of the media message and embracing the idea of the natural aging and something like that. What's your opinion about this?
Yeah, I think this is our burden, how to educate people that to maintain our healthy condition like in the younger stage is very important. So how to maintain our quality of life as in younger state of life, younger physiological age, not chronological age. As we know that there are two kinds of age, right? So we have to maintain our physiological age as in the younger age. Yeah? So that's very important. So if we can do this as a doctor, we can help people how to maintain our quality of life as in the younger age. Yeah. So we can do our job, our daily job, yeah, our daily activities as in the younger age. Yeah. I think this is the answer.
Yes, and from the social perspective, the anti-aging movement reflects a shift from aging as the natural process experienced by all process that you mentioned before. It's like enough sleep and exercise too as well. if our patient or us to do that, already do that, but get me my beauty. Yeah, so we need more treatment in aesthetic clinic, of course. It's like a double standard of aging. So what your suggest for it's aesthetic doctor in Indonesia, I think, with its strategy? Yeah.
I want to say that aesthetic aspect is very important. It's important also.
Yes.
In our daily life, yeah, because like I told in my slides that appearance is one of the factors that very important in our daily life, not only in couple relationship, but also in social interaction and social positioning also. Yeah, that's why in the top of the treatment, that's why I told before that our treatment that we give to the patient must be comprehensive. Comprehensive mean not only the appearance, but also the causes that disturb the appearance. Yeah. Finally, you can do treatment for the aesthetic improvement. So like whatever you want, like filler or buttocks, you can do that. But don't forget the factors that cause this wrinkle and melasma. You have to treat also the causes, the etiology. Yeah. Okay, I think it will be better finally for the improvement of the quality of life, not only the appearance.
Yes, I agree that because most of the patient is not concerned about the quality of life.
Yeah.
And how about the hormone replacement therapy that you mentioned? When we have to approach the patient with the hormone replacement therapy?
Yeah, of course. First, our basis is if there is signs, symptoms, and complaints. So whatever the sign and symptoms or complaints. So, for instance, if the patient come to us and then said, "Doctor, why I always feel tired, I always feel sleepy, yeah, I always feel sad," maybe this is a sign of actually. Yeah, it's this sign is very closely related to hormone problem. So you keep the sign, symptoms, and complaint, and then the second step is we have to do physical examination, whether this complaint related to the physical appearance, so like obesity, yeah, like wrinkles, yeah. Of course, that's closely related to hormone. And then the third step is you have to check to do the laboratory test to find how low or how high the hormone or how imbalanced the hormone. So with the three steps, yeah, we can find the data of the patient, and if there's no contraindication for the hormone replacement therapy, we can give, of course, with the monitoring and evaluation. So this must be used as a basis for doctor to give hormone replacement therapy, and this is very important. Yes. I have many patients who get the hormone replacement therapy. Their life began back to the normal life, with the quality of life, with the normal quality of life. Okay.
Yes, of course we have data for before we treat the hormonal therapy. Yes.
Before and after. Yeah. So for instance, after we gave treatment for 2 months, maybe we have to evaluate again whether the hormones increase or not. If the hormone is not increased or still insufficient, we have to evaluate again what happened. Maybe the dose is we can increase the dose, or there's still some hidden etiologies that we do not we have not to treat yet. So, for instance, if the patient with diabetes, we have to treat the diabetes first. Otherwise, the hormone replacement therapy doesn't work very optimal. So this is the example.
Yes.
Okay.
And the laboratory test, including the medical checkup and overall the laboratory to the market, it's not most of it is not related to anti-aging.
Oh yeah.
Yeah,
Yeah, so
it's
we have to.
costly for patient to do the medical checkup.
Yeah. So in my experience, I never send patient for the packet, you know. For the,
Yes, I agree.
for the packet examination of hormone. Yeah, because every patient, not all patients need that packet, you know, right?
Yeah.
So
Yes.
we have to choose what kind of hormone to be evaluated. It depends on the symptoms of the complaint of every patient. Not all patients have same complaint or problems. Yeah. So we as a doctor, we have to choose which hormone related to this their complaint. Yeah. And that's the first, the important one. And the second one is, I believe not all laboratory, yeah, can or have good examination for hormone. Yeah, because we know that to check hormone is a relatively high price.
Yes.
Yeah, and if the laboratory don't have enough patient, yeah, they will deficit with the agent, yeah, agent of the hormone to check hormone. That's why we have to choose which laboratory is credible for hormone test. Because I have many experience that the result of the hormone is not compatible with the symptoms of the patient. Yeah, in this case, yeah, and then I called the laboratory. I want you to check again the this patient test. Yeah, because I don't see that's compatible between the result of the hormone with the symptoms. And in my experience, there are many times after the laboratory check again, the result is different.
Oh.
Yeah. That's very easy to understand, because when we send the patient to the lab, yeah, to check the hormone, yeah, they only take the blood and then put in the machine. Yeah. So if the machine is not it's not, you know, it's not work right, yeah, of course the result is not right, of course.
Yes, thank you. And how about the genomic test? What do you think about that? It's necessary or not?
Yeah, there are now well known in some publication of the genome. I think it's as a new equipment or new what you call it, new equipment. So we can do that, but we have to evaluate again with the new publication of the genomic. Yeah. I think there are many questions in the application.
Yes. Yeah. Thank you. It's a lot of question in the live chat, Prof. From Dr. Nadia Carolina asks, Prof, what's your opinion about melatonin uses for anti-aging, especially in topical administration?
Topical is okay. Yeah. Topical is okay. There are some topical agent as a hormone replacement therapy, especially for women. Yeah, but it's okay. You can use that, especially for women who need testosterone replacement therapy. Yeah, it's considered to use the topical compared to injection. Is not allowed for women for testosterone. Yeah,
it's compared to orally.
Oh yeah, compared to orally. Yeah, but in my experience, to give topical to the men is, many of them don't like to use the topical. I don't understand why. Maybe because it's not practical for them. Use ointment every day, use topical of every day.
Oh, yes.
But
Maybe it's better
women,
orally for men.
yeah, or injection, yeah. But for women, it's okay. Estrogen, progesterone, and testosterone is okay. But don't forget, I just remind you all of my colleagues, yeah. If you get the patient, don't forget to have the good record of the patient, yeah. Before, after, yeah. Don't forget to do that.
Yeah.
It's important for us as a doctor to have the record of the patient before and after treatment. Okay.
Okay, thank you. Dr. Mehta, hello, Prof. Is it okay to use estrogen pills to decrease the symptoms in elder women? How about dosage?
Wait, what?
Estrogen pills to decrease the symptom in elder woman. I think it's correlated to menopause symptom.
Yes, of course. You can use that, of course. Like I told you that symptoms of the menopause, there are mostly, not all, mostly depend on the caused by estrogen, progesterone, and testosterone decrease. Yeah? That's why if you want to give a treatment to the menopause with their symptoms, yeah, don't forget to give this three kind of hormone. And then don't forget, if you feel more comfortable, just give them phyto hormone if you want. Yeah. But don't forget, the important thing is don't forget to evaluate and monitor. Yeah, how high, how increase the level of the hormone after you get treatment. Okay.
Thank you. Dr. Ubeta AMN ask, for menopause women, is it safe to use pill KB contraception as hormone replacement therapy if there is no contraindication?
Yes, it's okay. But don't forget, again, depend on the complaint. Yeah, if the complaint mostly about the dyspareunia, yeah, don't forget to check the testosterone also.
Oh, nice.
But don't forget that in the contraceptive pill, there's no testosterone, so you have to put another combination.
How about the dosage? It's regular doses.
Oh yeah, you mean for estrogen?
For pill KB using pill KB.
You can do every day.
Oh.
Yeah, every day, and then but don't forget to evaluate again.
Yes.
If there's bleeding, maybe so just reduce the progesterone. Yeah. So again, depend on the condition of the every patient. Yeah. Some patient, if you give menopause woman, if you give contraceptive pill, yeah, they will get menstruation again, and and this will disturb them. I don't want to get menstruation again, so you have to decrease the dosage of the progesterone. Okay.
Okay. Dr. Florendo Gomez. Hello, Prof. Impi. Related of the melasma problem, what hormone have correlation in women? Can we do the hormone replacement therapy for melasma?
Yeah, remember that melasma, you can many melasma in premenopause and menopause women. So don't forget to check again. Yeah, mostly because of the hormone already decreased. Yeah, of course it decreased. Yeah, during premenopause and menopause, and you can make balance. Yeah, balance between estrogen, yeah, and then testosterone. Yeah.
So it's individually cases, I think.
Yeah. Right.
A question from Dr. Mutri Yekti. Good afternoon, Professor Wimpy. I have several patient comes and they told me that they consume soya milk to enlarge their breast. What's about that, Prof?
That's young lady. Yeah, okay, but The problem is, as a doctor, you have to check first, the level of the hormone, whether normal or not, the estrogen. If the estrogen is not normal or decreased, you can give treatment, of course. But many times, the small breast is not because of the, not always, not always, small breast, not always caused by the low hormone. Sometimes because another problem. And don't forget to check also the other problem besides estrogen. Is it balanced or not? So for instance, if the testosterone is higher, compared to the it's not balanced compared to estrogen, of course, the breast cannot develop. So if you want to, if you consider this breast because of the hormone problem, so you have to check some hormone that related to the development of the breast.
Yes.
Okay.
Yeah. Continuing the previous question from Dr. Putriyekti, how long menopause woman should consume KB pills before evaluated, Prof?
Okay. If you give, for instance, if you give for 30 days, for
a month,
30 days, and then maybe it's better you check after 2-3 months, how their level of the hormone. Check again, and if it doesn't help, you have to improve the dosage and change with the pills. Okay.
Yes.
So the important thing is don't forget to always to evaluate and monitor. Okay.
Okay. Dr. Maria Angelina, hello, Prof. For how long we use hormone replacement therapy and for evaluation duration, what are your recommendations? I think it's.
You mean during menopause, right? In the menopause, you mean? Yeah.
Yes.
Yeah, of course. In menopause forever. Because the body of the ovary of the menopause woman cannot produce the hormone again. But it's okay forever, but don't forget to evaluate that. Okay.
If we take the hormone replacement therapy.
So the important thing is people, man or woman, who cannot produce the hormone again, they need, of course, hormone replacement therapy forever. But as a doctor, don't forget, we have to always evaluate and monitor, and don't forget always to check the tumor marker also.
Oh yes.
Okay.
The last question comes from Dr. Maria again. Most of the cases, problem with beauty lies more in women's hormone problem. How about the men?
Men also?
Yes.
This is not my topic, talking about
beauty.
Men, of course. Of course, men. We know the term andropause, hypogonadism in men. Of course, men also need important and absolutely need the hormone. So if the hormone already decreased, especially during old age, the men of course need forever. But sometimes if we give treatment hormonal hormone treatment because forever, many patients always ask, can I stop this treatment? So my answer always like this: you can stop if you get bored to take the medicine. You can have rest, but come back here maybe after 3 months, and then we check again whether your hormone level is still enough or down again. And then we show to the patient, oh, so look at this, your hormone level down again, decrease again. So now you need again. So why you need again? Because your body cannot produce hormone again. So you need forever, as long as doctor evaluate and monitor, you can take the medicine. Okay?
Yes, if a patient decided to stop the treatment, is that necessary to tapering off the dose, or
No.
maybe just cut off the?
No, for the hormone, you don't need that.
Okay.
You just stop and then don't forget to remind them. So if you feel the complaint again, come back here again. I'll check you again.
Or they have a run of money.
And but don't forget the basic of the anti-aging medicine, doing healthy lifestyle. Okay.
Yes, yes, of course. I think that's not question in the chat box, and it's the last of session. Thank you, Prof. Impi. Would you give us the take-home message to audience today for closure?
Don't forget to practice the concept of anti-aging medicine in your life. Yeah, no, it's very important. Yeah, because in my practice, in my daily practice, I have a lot of people that I already give treatment based on the concept of anti-aging medicine, and all of them, or most of them, feel that get much better in their quality of life.
Yes, agree.
Okay.
Okay. Thank you so much, Prof. Impi. It's your time. Thank you. Be safe and good afternoon.
Okay. Stay healthy and happy. Okay.
Sure. Thank you. You too. Thank you to all audience, to all attention. And we believe that this session until this morning will bring us more knowledge and benefit to be a better practitioner. Now it's time for break. Don't forget to join again in this room, the same room, at 14 p.m., 2 hours from now. Have a great day. Wassalamualaikum warahmatullahi wabarakatuh.
Bye-bye.
Bye-bye.